Give me a wave if you can see me. Hi Fikayo, hi Green, hi Gemma. Hello, hello, hello. Okay, I'm just admitting. I'm just going to use the next 2 seconds to keep admitting people in. Okay, admit, and we're just admit all. Fine. Okay. So good evening, everybody, and hope everyone is having a lovely Easter weekend. Yeah. So we're just going to go straight away to the point, really. I assume everyone has their children on holidays, so it's a little difficult for everyone having to, multitask and, keep an eye on the children out in the garden. My name is Dr. Ifeoma Duffing, and I want to thank the leadership of Black Women in Health, which is a charity that I'm working with this project today. The theme of the project is raising well and resilient children. So I'm a GP, I am a career coach, I'm a specialist physician, and I am an entrepreneur, but above all, I'm a mom of 3 children. I've got an 8-year-old, a 6-year-old, and a 3-year-old. So for me, being a mom in this setting, in these times, I find that I need to learn a lot. There's a lot I need to learn. There's a lot I need to think about when I'm raising my children. There's a lot I need to consider. There is the differences in generations and just lots of things to consider. So, and also working in the community as a GP as well makes me see the challenges of other parents as well, and just what the society expects now in 2021 and given the effect of the pandemic. So knowing that life potentially will throw different things at you. Look at it, we're in a pandemic now. So it's trying to think about how we can take a proactive approach when it comes to our children. Children are very young and very tender, but at the same time, they are very resilient, but depending on the environment and depending on the lot of parenting structures and strategies, they could lose their resilience as they go into adulthood. So the whole idea of this session is just to take a bit more proactive approach in raising children, raising them resilience, and trying to make them realize that they are tougher than they think and they are stronger than they think. So today we'll have 2 speakers today. We have a lovely lady. Her name is Linda Hall. She's out as a social worker, and she's going to talk about raising well and resilient children, looking from the angle of children who are under the services, what you as a parent can do to support them, to still make them get a positive outcome. There's a general consensus that children in services, under the services, don't do well. The studies have shown so. So for all of you who know people under the services, I think this is a perfect opportunity to come and learn. And I think she'll have so much value to add to us today. And after after Linda Hall, then we'll have our lovely Dr. Manuwa. I will introduce her later. She's a specialist psychiatrist, and she's going to focus on mental health today. So without much ado, it's 4:35 now. I think we should go straight to having Linda Hall speak to us now. So any questions we have today, we can drop in the chat. Any comments, just put in the chat box. Myself and Cynthia will be able to go through those comments and try and interrupt as much as we can, as politely as we can. Thank you everyone for coming today. It really, really means a lot. Thank you. So Linda, take the stage.
Yes, thank you. Hi everyone. My name's Linda Hall, and I'm a social worker, but I'm also a mum of 2. Sorry, I'm trying to change the screen so I can be able to share my PowerPoint presentation. In terms of the social work contribution towards parenting, I think we know that by the time families come to the attention of social services, there's problems, there's things that are happening, and therefore there's that added need of support. I work within the Looked After Children's team, which are children that are in care. So that means they've gone through the child protection process and gone through the court system and are now under the care of the local authority. There will be a full care order given, which has removed the children from the parents, and therefore the children are placed in foster care. Some are placed in kingship care. Some are placed with the grandparents, aunts, uncles. So it's quite a a massive scope of people that now tend to the needs of these children. And what we find is that these children have often experienced quite a lot of trauma. Now, when I first studied social work, I thought trauma always was really just the abuse, physical abuse, but not realizing that actually children are traumatized emotionally, mentally, and therefore there's a lot more to the parenting of those children than we would than we would think. But in terms of looking at it that way, you start to realize how much your own children need the same therapeutic style of parenting. So in terms of what I'd like to share with you all today, it's been about the resilience. And it was interesting listening to the message last month about resilience, and it is something that we are seeing a need for. So we are seeing children really quite young starting to self-harm. We're seeing children really affected by this corona pandemic. Children have had to change styles of socialization from going into school, playing with other children, to where we were this year with the Zoom classes. So there's been a lot, and I think parents have the opportunity and responsibility to ensure that their children's needs are being met. So I'll start off just talking about how, in the 21st century, depression really is a reality for children. We're seeing increasing number of children suffering with mental health, and it goes quite low to like 6 years. So, most of us will think the children are really going to be aware of what's happening older than 6. But then obviously, if children are starting to have mental health problems at 6 years old, we know that we need to start to do some work to, with them. I was going to just briefly speak about the four styles of parenting that are quite popular. They're known quite well. We've got the authoritarian parenting style, which unfortunately is quite negative. It's the aggressive parenting. It lacks warmth and comfort. It's hostile towards the child. It's harsh, and there is verbal abuse. Now that might not be F's and M's and S's, but it could be just when a parent says, "Oh, you're stupid, you're useless," and those type of words, really harsh towards the child. Then that type of parenting leads the child to being fearful in their home. Now, home is supposed to be a safe place. For all of us, you come in, you lock your door, and you think, "Oh, boogeyman's outside, nothing's going to happen to me." Home is supposed to be a safe place for our children. But this type of parenting definitely does lead to children feeling fearful of being in home. It crushes children's spirits. It makes them mistrustful of others, and it lowers their social competence, and self-reliance, and sadly mental health issues. The second style of parenting I would talk about is the uninvolved parenting. This is where parents leave their children, do what you want, they're neglectful, as parents, and this is even to the child's basic needs. What this does, it leads the child to finding it harder to form relationships with others. It leads children to poor self-esteem, high rates of negative, lifestyle. So a child that doesn't have boundaries is able to do what they want, and that can hurt the child. The third form of parenting is permissive parenting, which is inconsistent with their behavior. So parents are harsh and demanding one day, and then the next day they're like, "Oh, do what you want to do." Children are constantly unsure. What am I supposed to do? Mommy said yesterday, close the door. Today's like, why did you close the door? Little things like that. It's very confusing to the child, and it makes children uncontrollable and impulsive because they don't really know where they are. And then it's also quite hard to pacify and manage these children. And you find oftentimes children are a lot more immature than their peers. And this is a long-term negative aspect. The fourth type of parenting is the authoritative parenting, and that's where parents are listening to their children. Parents allow their children freedom to express their feelings. It's structured, It provides a secure environment to the child. It sets high standards of behavior, and it's warm, supportive, and this helps, children, in terms of the achievements. What we see with that type of parenting is that children have a lot of self-confidence. Children are socially competent. Children have high self-esteem, and they get good grades, and they, psychological distress is lowered, lower levels of psychological distress with them. They're able to form, and sustain relationships. They can form relationships and sustain relationships. So our children, by the time they come to social care, have experienced one of those 4 forms of parenting. Now, in terms of the topic we have today, the topic we're talking about is about how we can nurture children to produce positive outcomes. And resilience is the theme behind it. How do we let children, how are we getting our children to a point of being resilient and dealing with what they have to go through, and how, and in them moving forward. Ify, I'm so sorry, I was trying to see if I could share my screen.
So if you click share screen, literally at the bottom tab, it says mute, stop video, security participants, chat, and share screen. Can you see that?
Sorry, just 1 second. Yeah, we are.
Can you see that?
Yeah.
Yeah.
Here we are. Okay, so that was just sort of my introduction. So when we're talking about nurturing children, I'm just going to go through these. So, sorry, so if we are, excuse me, sorry, just 1 second. I'm really sorry, ladies. Okay, so in order for us to nurture our children to create, a positive outcome, oh dear. Okay. Okay, so I've just put a bit of, can I just lower this? There we are. Okay, so I've said, if you're like most parents, you have an image of the kind of person you want your child to be. When we first fall pregnant, we know we're having a baby coming, and once, let's say, for instance, the sex of the child, you start thinking, oh, football, he could one day be a footballer. If it's a girl, she could become a ballerina. And, we've got this idea of the what we would like our children. We want our children to achieve and to succeed. So like most parents, we would want our children to grow up to be successful, smart, kind, thoughtful, and maybe a good friend. So I feel parents play a large role in making this happen. Research shows that the key in responsive care, the process of watching and tuning into your child's cues and thinking about what his behavior might mean and responding in a sensitive way. Now, I've got 2 children. I've got a 16-year-old and I've got an 8-year-old. So my approach when I'm thinking about their response has to change. I can't have the expectations I have for my 16-year-old as I would for my 8-year-old. So therefore, I think parents, the process that we have as parents in terms of responding to our children's cues is quite significant. So I've said I'll be sharing a view for parents and carers who want to deliver the best outcomes for their young children and young people. So in social work, we have a lot of theories, and we have a lot of theories that are behind what we do. So we use lots of theories and models. So I will sort of briefly just touch on some models, but the models that we discuss may help us for children who have experienced relational trauma to benefit from new relational experiences that are crucial for their development. Like I said initially, our children come into the care system because there's something that's happening. Children are experiencing trauma. And one of the things that trauma, like I said, is not just linked to the physical harm, the neglect that they receive in the home. It's really a broad topic. And our children do experience some trauma. Examples I could give would be losing a grandparent, mum loses her mum. The focus is on mum and comforting mum, but child is sometimes overlooked. And that can be quite a traumatic experience for a child to lose their grandparent, or to lose a friend, or to lose a dog. And therefore, children are experiencing trauma outside the care system. So it's not always the typical, oh, this is why a child's in care. So it's quite important for us to understand that, we need to support our children and support children that have experienced trauma. So with children that come into the care systems, our foster carers tend to have to do training. And one of the, probably I would say it's promoted a lot by, CAMS, the Children and Adolescent Mental Health Service. And that is on therapeutic training, parenting. And therapeutic parenting is about, the style of parenting that, parents will give. And so I'm going to be using a pyramid based on that therapeutic type of parenting in this presentation. So this I've done, the screen is showing just just that exist and that people use in social work. So we've got the ecological systems theory, we've got crisis theory, we've got the family life theory, cognitive theories, we've got behavioral theories. Like I was saying, there is so much that you're looking at when you're working with families, children and families, but these are all the same type of theories that we can use within our own personal family life. We've got empowerment theories, which really also contributes greatly towards our children's resilience. So in terms of being positive, we know that we're families, we've got to implement change, and implementing change will be varied. So I'll just touch on a few different topics. Okay, so the first thing we're going to be talking about is nurturing and attachment. So children's early life experiences, and that is normally calculated from the 0 to 3, that's your early life experiences. Children benefit greatly when they are nurtured, and they develop a bond with a caring adult. And this affects almost all aspects of life and development. So we would see if a child has a parent that maybe, leaves them in the cot for a long time, gives them the bottle to feed themselves, those children really struggle with, sort of developing a sense of confidence in themselves, or they become overly attached to people. So the minute somebody comes in to just say hi to this baby, the child attaches because he's been lacking that sense of, that aspect of attachment. So it's so important for us to understand that the early experiences of our children actually contribute towards their development, their behavior and their development. So when parents and children have strong, warm feelings for each other, children develop trust that their parents will provide what they need to thrive, including love, acceptance, positive guidance, and protection. Now, for a number of our looked after children, we do see that there's a lot of mistrust because they've lacked on that initial development stage of their life. They haven't received the love, they haven't received the acceptance, they haven't received the positive, emotional support that babies need. The smile, when a child does something, you smile, and that's feeding off the child. So for a lot of children that are in care, we do see that they do struggle a lot with mistrust. So an important factor for a parent, any parent, and it's irregardless of the age, we need to include love in our parenting. We need to include acceptance. We need to have a positive guidance, and provide our children with protection so they know that they are safe. I've put this, it's the Nurturing Children wheel, and it's just touching on what it is children would need to receive nurturing, appropriate nurturing from us. So I'll start with promoting emotional security. And this is about talking to the child, and allowing the child to feel safe and comfortable, to be able to express themselves. As a parent, it's about being gentle, being dependable. The second one is providing physical security. Now, we know the 5 things that man needs: food, shelter, and we talk about that. But for our children, this is quite a key thing, that children know that they are going to be provided with food, that children are going to know that they have shelter, clothing. Now, I guess because the platform we're speaking to, Dr. Ife, there's a number of doctors and a number of professionals in this meeting today, but those things that seem like such simple, natural acts that a parent is supposed to provide, a number of children are going without. So a number of children are going without food. We've seen the coronavirus come in, and the impact it's had financially on families is really great. Food banks used to give food, to, let's say, a minimum number of families, and food banks are at a point where they're at crisis. They don't have anything to give to families that are coming because the numbers have increased so greatly. Therefore, that simple provision that looks like it's an average, children are going to be able to be provided with food, has become one. Then we talk about providing discipline. Now, I'll speak a little bit more about discipline in the future, later, but we're talking about being consistent, ensuring that rules are appropriate to age and development. Like I said, I've got a 16 and an 8. The way I have to, relate or discipline my children is very different because of their age. We talk about giving time. To be able to nurture children is about giving time. We live in such a busy world. We live in a world where there is no time, and sadly, children miss out on the day-to-day time of mommy. I will speak about time in some suggestions about time as well. We talk about encouraging and supporting our children. We talk about giving affection, hugging, holding hands, just maybe even patting someone's head, you done well, just affection. And then we talk about caring for themselves and caring for, as a mom or a dad, you've got to care for yourself to be able to care for your children. We talk about trust and respect, acknowledging that a child has their feelings. We need to be aware that children will have their feelings. In order for us to nurture them in the best way to get positive results, we need to acknowledge those feelings. See. Okay. Sorry. My computer's frozen. I've been having problems with my network. I'm really sorry, ladies. What's going on here? Here we go. Okay, so the impact of COVID-19, that is something that we've all seen, and that has affected families. In terms of social services, there've been a lot higher cases raised. I was hoping to provide you with statistics, and I'd made a request for some statistics, and I didn't get them because I wanted to give you like an accurate figure of where we were today compared to maybe where we were last year. A number of families have had breakdowns, and children have had to end up in the system. A lot of families have had, because people have been kept at home, there's been a lot more domestic abuse, there's been a lot more neglect cases because families are not able to provide for their children. So the COVID-19 has definitely had a massive impact on our children. Right, so I put this as the great debate, but I guess in terms of time we don't have, and that is about the nature versus nurture. Our children, the behavior, the personality, the cognitive traits, the temperament and psychopathology, is that based on nature or is that based on nurture? Now, with children in care, there are children that have been removed from their families at 6 days, at 6 months, at 6 years, 16 years. And there's obviously the impact that's, it's obviously the impact that happens when social services become involved. There is that. So I would have liked to maybe just sort of had a few questions and just ask from people their views. Do you think children really are, adults by the time we turn 18 and all, are we a result of the nature or is it the nurture? But I guess, I don't know, I'd set a time and it's saying 20 minutes already.
It's a valid question. From what you said, your question is, when children become 18, do you think that the way they are as people is as a result of how they are naturally, they're made up naturally, or the fact of how the the parents nurtured them. Is that correct, Linda? Is that the question? I think that's the question that has brought about this presentation, because I'm not really sure about the answer. I'm more inclined to believe that there are elements of nature, but I do believe that the nurture is actually more important than the nature. I feel like it's like saying, there's a saying that they say hard work beats talent. If you're talented, you're just talented. You can't just walking around saying, "Oh, I'm talented, I'm talented, I'm talented, You know what I mean? It's like you're gonna, and the person who's not talented, like me, we're busy there working and toiling at the back. Do you see? And you're just, I'm talented. So I kind of always feel like the nurture is the most important part, which I feel a lot of parents need that support, because once you realize it, then you don't just sit back and say, "Oh yeah, it's nature. Oh, we're like this and we're gonna be like that." Yeah. I mean, does anyone have any comments? I'm just gonna mute myself now.
Sorry, it looked like you were saying something, Dr. Ify.
I said there's no comment in the chat box so far. Yeah. So I mean that's my own take anyway to that.
I think it's one of those interesting topics, isn't it? Because you do have families pushing their children so hard. You've got to achieve, you've got to achieve, you've got to achieve. And a child could be like Bill Gates, where university is not the path he's going to go to, but he'll choose, the talent, the nature path, the natural ability that he has. And that could make a child successful. So I always think this is a great debate. You can sit and talk for quite a long time, just trying to establish whether we think our children are achieving because of the nature or the nurture. But nurture is going to be key to the outcome for any of our children's lives. So when I was talking about nurturing care, this is referring to a stable environment which is created by parents and other caregivers. Like I said, a number of our children are in foster placements, but they also are in kinship care placements. So any other caregivers, and this ensures that children have good health. And it would seem quite you think it's an expected thing that children should have good health and nutrition. But one of the things that we found with a lot of our looked after children, so a lot of times we do, there's a lot of feedback given by children, a lot of, work is done to consult children to get their views as to say, okay, as a looked after child, what do you think, you benefited from, or what do you think could have improved? And one of the greatest success goals that the children themselves, and this is the voice of the child, this is professionals going to children, getting their voice, and that is where I will live and how I will feel safe and secure. To children that are in care, those two tend to be the biggest thing. Children want to know, where will I live? Right. So you will meet a child that's 17 and they've had 8 placements. They've lived with 8 different foster carers. That's a tough thing. So for a child in care, the biggest thing is, where will I live? And one of the things that we aim to do is provide our children with permanency. So if they get into a placement, we are working towards making this the permanent, last forever placement. We don't like our children to be sort of moving around. And the second thing is, how will I feel safe and secure? Now, if you've moved twice, your feelings of safety in a home are not there. So it's so important for children to have this feeling of security, of I feel safe and I'm secure. My mom and dad love me and I'm going to be here. Just my grandma, my aunt, whoever it is, just making children feel safe and secure. Children want to know about their connections. Who am I going to be connected to? How is that going to work? How will I feel? How I feel? Is my voice being taken into account? Is anyone listening to how I feel? And so for caregivers and parents, it's so good for us to ensure that children have, protection from threats and harm. We want to give our young children opportunities for early learning. And this, like we said, is through interactions that are emotionally supportive and responsive. It's really important for us to consider the child and their emotional. So like nurturing means more than giving your child food, shelter, and clothing. It's about building a healthy and strong emotional relationship, which is that attachment that you have. As you know, it's often seen when a baby is with their mum that, you know, the minute that child just goes into the mum's and child's crying with someone else, and you just give the child to the mum, and instantly the child just goes quiet and is calm. It's that attachment. So even though it might not have been as tight as it was at the time that the child is born, it is an attachment that can be developed. It's an attachment that we can, you know, increase. You know, the more we do with our children, we can develop strong attachments that are going to be healthy for the children. So it also is about being the person that your child can count on, and that's going to be for comfort. And I've put this to say, whether there's a fussy eater or a toddler having a temper tantrum, you know, mom's going to be the person I go to for comfort. So, sorry, I'm just going to go past that because I think I've spoken about that. Here we go. Okay, so we feel that children and young people, we need to ensure that their needs are met and that their rights are respected so that they reach their full potential. And this is like just about childcare and how we let our children. So, sorry, I'm just going through some of them just so I don't take too much time. The principles of nurture. So I've just put a few. So I've put as number one principle, I feel children's learning is understood developmentally. So it's about, as a parent, being aware of what is expected of your child and at what age. You know, a 4-year-old really wouldn't be expected to cook a meal, you know, but if I got my 16-year-old to cook a meal, very expected, you know. So it's about looking at what your child's learning is to be understood, you know. It's about, again, home being a safe base. And I think one thing I would like to say is that home really and truly is the training environment. We're not sending our children to go out to school to learn to be better people, or to, you know, we want that work done within the home environment. We want the nurturing done in the home environment. Our children should go to school, get their education, come home and continue to be nurtured. You know, parents should not be leaning on, this sounds, it might be offensive to some because, you know, but I really feel that parents shouldn't be leaning on the ancient saying that it takes a village to raise a child. It takes a mom, a dad, an aunt, a grandma, the family to raise the child. If we're leaving our children to go out and expecting them, especially in the Western world, what they're going out and learning isn't going to really be, you know, conducive for a bright, positive future. So it's really important for us as families, as parents, and, you know, caregivers of children to say that that raising of the child is done in the home environment. So I've put that the 21st century village cannot be allowed to have significant influence on your child. And this could be even TV, you know, just, I mean, like a lot of parenting is with the pressures we've spoken about earlier. The world is under pressure. We do not have time. So it's really easy for a parent to say to the child, here's your tablet, go sit in your room and watch your tablet. Here's my phone, play on my phone. But do we want what the children are accessing to be, you know, the underlying, the foundation of who they're going to be? Because to be honest, there are times when children are watching, it could be, let's say, Roblox, which is quite popular amongst children, but some of the content, the conversation that's happening there is inappropriate for children. So it's really important for us to say as parents, we're not going to allow the 21st century village to raise our children. You know, we're going to be partaking in terms of the raising and nurturing of our children. One other thing is the importance of nurture for the development of well-being. It's really important for children to be nurtured because it's instrumental to helping young children, or even, you know, young people to start their life. You know, that nurturing process is beginning to just build on them so that they can continue to grow and grow and grow. We talk about language, and that is also a vital means of communication. We need to use language to bond emotionally with our children, you know, and that's key, you know. Smiling at a child, hey, good morning, are you okay, how was school? Children bond with just that. And it's, you know, so we need language. All behavior is communication. So we have parents, women, for instance, we have tough times. You come home, you have an upset day, you've had a hard day at work, and you come in and your face is really like evidence to the child that do not even come to mommy and ask for something. You know, it's about us being able to compartmentalize maybe our lives and be able to come back to our children and say, I'm home, my child needs me, be it 5-10 minutes of my time I'm giving this child because I want to nurture relationship. I want, my child to have appropriate, contact with me. So when they see mom, it's not always just one-sided. And like the 4 types of parenting, we talk about the parent that's one day this, one day that. The child doesn't know. It's very confusing. So we need to try and maybe work on ourselves as well. The importance of the transition in children's life. With our looked after children, we have what we call words and pictures. So when there's any significant change that happens in a child's life, we do a piece of work and it's called words and pictures. And it's basically telling the child what it is that's happened, but we use it like we draw a picture. So for instance, if a child needed to move to a new placement, you would do a words and picture piece of work. It's just literally a sheet of paper split into 4, and it's 4 little stories. So you could be saying, okay, this has happened, this old, you've lived with so and so and she's not well, and because of that we're going to move you to this person. Oh, they've got a dog, they've got a cat. And it's a small little piece of work, but it's so valuable for a child. And the reason it's so important for children, if there's any transition in life. So like I mentioned earlier, if there's a death, if there's a bereavement, if there's a family breakup, husband and wife are splitting, oftentimes children don't get that talk that says, look, mommy and daddy aren't getting on really well, and daddy's going to move out. You'll be able to see daddy maybe on weekends, or daddy will come around and see you. It's about that. Any transition, our children need to be aware, and we need to speak to them and share that with them, because it always leaves them quite lost as to there's something significant. My mom and dad were together and dad's no more here. What's happened? And as adults, we feel like we don't need to share that with our children, but it is quite important for nurturing them, just because that will improve who they will be in terms of, strong, mature adults. So we feel that children and young people we need to ensure that their needs are met and that their rights respected, and that the rights being respected is what I was saying about even sharing something really, it's quite mature. It's a big piece of information to tell a child about a breakdown in a relationship, and sometimes we feel like we shouldn't even just mention it, but just even if you make it age appropriate, that's important for a child to know. Parents, so we found that a lot of times parents are not offering sufficient attunement and responsibility to children. So they're not picking up on their children's cues, or misunderstanding the children's cues, so it's quite important as a parent to really get to a point where you know your child, so that you are able to pick up on their cues, because parenting is going to be about a two-way relationship, so if you've misunderstood what this child is actually asking for, it could lead to sort of like a division or a separation. Then we also talk about how parents sometimes are not sufficiently available for the child. Now that's also linked to our busy schedule, So one of the pieces of advice that I would have said would have been involving our children in our day-to-day things. So sometimes we're cleaning and you're thinking, I've got to do the house. You can get your child involved in it, and like, okay, I'm going to be, or when you're cooking, get the child to come and maybe just cut up a potato, just in that room while you're cooking, you're talking, you're spending some time together, you're allowing them into your busy schedule. But even if it's just a little piece, the children are sharing time with you. So it's not always like, oh, I'm in the kitchen, I'm cooking, stay out, and and then you can sort of include your children in your life. Okay.
I have some comments, Linda.
Okay, sorry.
I have a question actually. It's in the chat box. Can you go to your chat room and see the questions? I think the question I asked was when children. Okay, so there's a couple of comments. Someone said, as parents, it's about finding the right balance between nature versus nurture. It's important for parents to nurture the strengths of the child's nature, which makes sense. So you nurture the nature. And someone also commented was, I totally agree, kids can be nurtured to maximize their natural talents. The question I asked earlier on was, You know, when children are handed over back from the services to their parents, I mean, from your experience as a social worker, how do they do? And is it usually just, just discharge the patient back to the families, or how do they do? Do they thrive? Which sort of behaviors or tips have the parents now acquired from you guys that have this like real life story? Do you see what I mean? This child went into service and then they went on to become a professor and things like that. What sort of things do you as a social worker add with respect to those sort of children? I think that's yeah.
Okay, so in terms of returning a child home to the parent, we call it placement or parenting, and it comes under regulation either 17 or 19 of the Children Act. So what happens with a placement or parent? Children are taken from their parents after a lot of work.
Okay.
So they'll have early help coming in. If there's things that need to be resolved, let's say, for instance, if it's a case of neglect, the house is not appropriate, there's no carpets, there's no bedding, the children got no curtains, social services will come in, they work with housing, they'll come in, recarpet, they'll do up the house to a standard that we think, okay, this is where children should live. Then they'll be having support workers coming in to work with the family. If they continue to, maybe not meet the standard and the children are removed, prior to their removal, there'll be what's called a parenting assessment done. So let's say it's a situation where mom and dad were suffering with substance misuse. I'll use alcohol as an example. 6 years down the road, they've gone to turning point, they've had work done, they've done parenting classes, they no longer drink. We begin to think, okay, they've made changes, appropriate changes to their child. The child's only 9. He's at an age where he could be returned. Before he leaves social care, he's got another 9 years. We'll go back into another parenting assessment with the family. That one is a little bit more stricter because that one is going to be spot checks, just pitching up as and when, because if I come to your house and today your house is spotless, you knew I was coming. But if I come 3 weeks down the road, you're not expecting me, and I find there's glass everywhere, because you do find families that are struggling. In that type of situation, we'll say, okay, they've met all those, but we aren't going to return the children. So we might start with something like overnight stays. Child could go overnight, maybe 3 times a year, increase it to 6 times a year. But if the parents have proved hard and the parenting assessment is positive, the child is returned home. But you don't revoke the care order in the beginning. It's a case of working with the family until we feel that, yes. So they will still get quite a lot of support from social care. So you will still have a lot of social workers involved. Schools are really key in terms of some of the work we do. If there is any sort of health body that's part of it, we sometimes have our LAC nurses involved. So there will be quite a lot of it, but it's about the parents really evidencing the changes. So it's about the parenting report that you had when the children were taken and the parenting report that you have to give
after the children. Okay. So the very last question, Linda, before we wrap up, I think it's time for our next speaker. Someone just commented the very last question, just hopefully just a minute to go through that question. Is there a role for a supportive community and network in nurturing children in the context of it takes a village to raise a child? I think that person's probably asking who are the members of the village. I believe it takes a village, but you're right. It depends on the members in the village, not just villagers in like 21st century random villagers. We're talking family networks, close friends. Yeah. So
I will say, just in terms of the village, so when I'm talking about not allowing the villages, it's just about letting our children loose on the street. So with our looked after children, when a child is removed, we have what we call a safety plan. And that safety plan is us sitting with the child and the family and looking and saying, okay, in the event that anything could happen to this child, who is the first person of point of contact? If he came home, mommy's drunk, and he's come from school, who does he contact? So we do involve the family. So you might have someone say, oh, I've got my Aunt Becky, or I've got this person, or my mom's best friend, or my mom's this and my mom's that. So for us, that's the same community we want to help us with nurturing our children. Because if I can trust that you're the person, if Dr. Ify is the person my daughter's calling when she needs help, I want that person in my village. You know
Okay.
what I mean?
Okay. That
So
makes sense. So
we
it's
still
about
involve the
who
village.
is in the village and
Yeah,
who are the members in that village.
their
Okay.
contribution, because blood family is not always the best. In
Not
terms of
necessarily.
so I could
Mm.
have a sister that's on drugs, and then my best friend could be like an exemplary mom. I would rather my best friend be in my village than me say, okay,
Mm.
let her be raised by my sister. So
So it's all about picking out the peculiarities of the people you want in your village and the people you can
contribution.
trust
Yeah,
that are responsible. Thank you so much, Linda.
very
Very,
welcome.
very useful. I've yes. So yes. So who is in the, who is in the village and who are the village members? Someone just commented. Yeah, it does matter. It does matter. It's not about just picking out people in your in your church or your race or your ethnicity. It's about picking those sort of people you can trust, who are responsible, who have good track record that you can actually entrust your little ones, your loved ones, into. Thank you so much, Linda. That was really, really educative. I mean, it's important to know that even the social services do carry out parenting assessment pre and post. So
Yeah.
putting children in care is not always forever doom and gloom.
No.
um Okay, so what we will do, CY, what we'll do is that we'll probably bring our next speaker in just to know. Obviously, I know there's going to be lots of questions and lots of comments at the end. Thank you, everyone, for staying tuned. Um, Thank you so much, Linda. Really, really useful. Thank you. Really appreciate it. Dr. Manu, are you there? Can I see your pretty face? There you are. Hi, Fikayo. So let me introduce her. So she's my friend's wife. She's Captain Damola Manua's wife. I know. So yeah, so Fisayo is she's a psychiatrist. She was a consultant psychiatrist in Nigeria, and she's now a specialist psychiatrist training on the verge to be a consultant again in the UK with a focus on children. And this whole thing is about children. So she has lots of experience in that department. And obviously, she probably has a lot to tell us coming from like I said, a different system where she worked in mental health to this system where she's now working in mental health here and with children. So she's going to talk today about managing mental health in children as parents, because mental health in children is not always medication. As parents, what we can do, and obviously prevention of stress and anxiety in children, which is on the rise since the COVID pandemic. So Fikayo, can you take the spotlight? We're happy to have you here. There you are, pretty face.
I yes. So as Ife said, what I'm just going to do is just highlight, because I have a short period of time. I'm just going to highlight the major or the common mental health illnesses in children, then talk about stress and preventing stress in young children. So I'm just going to share my screen.
You're not loud enough, Fikayo. I'm not sure why. Do you want to increase the volume of your
Can you
laptop?
hear me now? Is this any better?
Slightly, just a tiny bit, not perfect, but yeah. Oh,
Okay. Is this much better now? Can you hear me?
well, I can, but not perfect as well. So
That's
let's go.
100. I think yeah, probably
It's 100, isn't it?
yes. Sometimes take a bit of time to hear me, so I'll just try and scream as much as I can. Is it any
Yes,
better
better
now?
now.
Yeah.
That's better now.
It just take
Yeah,
a bit of time. It's yes,
yeah.
okay. So as I said, I'm just going to talk a bit of about mental health in children. I'm just going to highlight the major ones and talk about briefly about prevention and management of stress and anxiety in young children. So let me just go to the first slide. So it's mental health or mental disorders in children. They're actually serious changes in the way children typically learn, behave, or handle their emotions, and this can cause them distress and problems to them and other people living with them. So what it will see is that when you see a major change in any young person, the way they change in the way they talk, the way they think, or the way they behave, is when we start thinking about, is there a mental health difficulty in children? And they're quite common. We actually see that in up to one, as that's 25% of all children, 1 in 4. So that's rather very common. So if you think about it, in 10 children, you're thinking about two and a half kids. So it's quite common. And the how common it's actually commoner in younger in boys up till the age of teenagers. Then we then see a change by the time they get older. And sometimes we find out that the externalizing behavior is commoner in boys. So when we say externalizing behavior, we're talking more about temper, temper tantrums, aggression, bedwetting, while we see things like low mood, anxiety commoner in girls. And when do we say that as a parent? When do you look closer, or when do you start thinking, or when do you begin to suspect? You see a change in your child's behavior. So a child who was previously very happy, very bubbly, all of a sudden is becoming very withdrawn, staying in their home, staying in their room alone, not wanting to talk to any other person. Sometimes it might be related to age, but sometimes you just need to look, you might need to start thinking about looking closer. When you see that compared to your child or to other kids, there is a difference, or there's a difference between the first child and the second child. So this is when people start thinking, you need to think about that. Or you see a change in a regression in behavior. So a child who was not bedwetting, has been dry for a while now, all of a sudden starts bedwetting again. You need to think about that. Maybe there's a problem. When we have complaints from school, from teachers, from friends, or from family, then you need to think about, is there a problem? Do we need to look closer at this child? What are the common mental health? So we think about anxiety. I'm sure everyone has heard of anxiety. We talk about depression, the commoner things. We talk about ADHD. There is no parent who has not thought about it. Even as for us ourselves, you think about it. Do I have ADHD? Or as mothers, one of the things we think about, this is my child have ADHD. And whenever you listen to something on TV, or talk about autism, like if you're in the UK now, like literally, there's so much talk on autism, and right now there are a lot of kids that are being on the spectrum. And the thing is, in life, really, it's all a spectrum. So there we have things like conduct disorders or ODD, which is where we see children who are extremely naughty. That's how we talk about that. So I'm just going to talk quite briefly on each of these things. So anxiety, what do we say anxieties? Generally, everyone, we have anxieties. We tend to have fears. We have fear of kids have fear of the dark. You have fear of a dog, but when it becomes quite worrisome is when that it begins to affect with the daily activities of life. That's what we say with daily activities. Your child struggles to go into school, travels to even like as a parent, if you're going out of the house and your child is really panicking and in tears, total meltdown because you're going out, then we sometimes begin to worry about this. Sometimes because we don't really think about it, but when you have a child who is constantly complaining about tiredness, headaches, and stomach aches, we need to sometimes think about it. Is this an anxiety disorder? There are various types of anxiety disorder. So I've said there is something called generalized anxiety, where the child is anxious about everything. You have things like phobia. So particularly you're afraid of a particular thing. Sometimes the darkness, it might be snakes, it can be spiders, where there's this major fear of this. We have things like, as I said, separation anxiety, where once you're away from the parents, the child are not able to function. So those are things about anxiety. And the next, sometimes you have things like social anxiety, where your child is afraid to talk in front of people. So when they get into school, they're not able to talk in front of their friends. If you're in a social setting, they actually just clamp up and not able to, they actually have panic attacks in this type of situation. So there are various types of anxiety, but one of the things is how do we manage with this? How best do we help children manage with this? Is to say that a lot of times kids would outgrow this anxiety, and it's just to support them when they're feeling quite anxious. But other times you might need to see a specialist. Then we go on to depression. With depression, it's normally with everybody and in life, things, you do feel sad. Sometimes you do feel hopeless. It's part of life, but when it becomes to a point where there is significant, it's affecting your, what we say, the daily activities of living. And that's when we talk about that. We talk about family. How is it affecting your family? How is it affecting your school functioning? When that sadness gets to a point where there is a problem in school, then we need to, that's where we think about it. So things like what do we see? What do we see as doctors, or what do you see as parents or as a teacher? Is that the child's feeling very sad. You're feeling quite hopeless, and hopelessness is actually one of the key points. It's different from just feeling sad. You just don't see when you talk about the future, there is just no hope for the future. That's one of the things. And for children, you can actually see that instead of them feeling sad, you just find that they're irritable. So you're talking to them, they're just very cranky. That's sometimes, so it's a bit different from in children than in adults. You might just see the kids being very irritable instead of feeling quite sad. They don't want to do anything, or they don't even enjoy doing things. So one of the things is, it's called an anhedonia. That's the medical term. But So when you say, well, if you're playing your game, do you still enjoy playing a game? And they're like, I just do it because I have to. Or when you are out with your friends, do you enjoy that? It's one of the things we see. There's a change in eating patterns. So either they're eating too much or they're eating too little. Children are either sleeping too much or too little. Those are things we also see with kids that are feeling quite depressed. They might feel a bit tired. So they say change in energy levels, quite tired, sometimes sluggish. It's a bit, when you have teenagers, it's a bit like, ooh, what's going on? Is this, sometimes, because as parents of teenagers, if you have any teenager or you've grown up at there's this, that sometimes you see that in a lot of teenagers. So for a long time, actually, a lot of people did not think kids, teenagers or young children were feeling depressed, because they just assumed all of this was just a part of normal teenage behavior. But we need, as parents, to sit down and think about it. Do we think there's a difference? So that's why we need to compare them with your other children, also compare them with friends' children before you think there is something going on. There's another thing is self-harm, which is, Linda's talked a bit of that, and it's quite, when I say, comparing Nigeria, where I initially trained, to the UK, it's prominent, much more prominent here. And even in Africa, in Nigeria, there's a rapid increase in this. It's because when children are feeling very overwhelmed, they do not know how to cope with this, their emotions. Then for them, self-harm is a way out of this. So those are things we think about, we see in people that were depressed, or young children who are depressed. We have things about suicidal behavior. And actually, so self-harm is just a way. Self-harm is not with the intent to die. It's quite different from having suicidal behavior. So suicide is another thing we see, or suicidal behavior, or where children are taking significant overdose or having a particular suicide plan, is what you see when children do have depression. Towards the end, I'll talk about how do we manage this with our young children. So, but if you have any questions, you can also put that in the chat. The next thing I'll quickly talk about, I'm just trying to talk about 5 minutes. I know it's too short a time, but I'm just trying to cram in everything within 5 minutes into each of these topics. So the next thing I'm going to talk about is ADHD. Well, I'm sure we've heard ADHD before. I'm sure everybody thinks that at some point in time they've had ADHD, or especially when you have young children. Does this child have ADHD? It's when you have a lot of kids have difficulties in paying attention. That's one of the things. So it's attention deficit hyperactivity disorder. So as it says, they struggle to pay attention. They are constantly on the go. They're hyperactive. The child zoom. Can't sit still. They're constantly fidgeting. They call them squeamish kids. So they're sitting down, they're moving in the chairs, and they're like, sit down there. And it's when we're talking about it, we say it's age appropriate. So for a 4-year-old child, you probably don't expect him to sit down for 30 minutes. He's going to run around, But for a 10-year-old child, when you say we have a 10 to 12-year-old child who's not able to sit down for 30 minutes, you're like, no, that's where you begin to think about, so maybe there's something going on. And for ADHD, it's commoner in boys. This is a type of externalizing behavior. So we see this commoner in boys, about 3 to 4 times commoner in boys. Sometimes we say that with things like ADHD, there's really no major, with a lot of mental health disorders, there's no cure. What we do is, how do we manage this while they're in school? As I've spoken about some of the symptoms, they're unable to get through school because they're constantly distracted and unable to finish their homework. They always get into trouble because they're not able to wait their turn. They have some impulsive behavior, so sometimes it can be dangerous. So they want to cross the road. They're not able to sit and think about it, or stand and think about it. I need to look left and right. They rush into the road like that. They get quite irritable and very angry, and they're constantly lashing out at people or their friends. So sometimes they have, when you say dream a lot, we see that usually in girls, they tend to dream a lot. They may forget things or lose things a lot. As I said, squirm or fidget, make careless mistakes, and these are a few of their symptoms. You see that. So for just a few things about ADHD, one of the things we do is we don't go straight into, because I'm sure you would have talked about, people we hear about medications, it's not the first line. Usually we everything mental health. It's not usually the first line. We do talk about parent skill training. We also talk about how to help school, to help this young people to manage better. Medicine or medication is usually the last resort before for any of these mental health conditions. And the next thing to talk about is the ASD, what we call ASD is the autism spectrum disorder, and it's a spectrum. So when I say spectrum, it's a long, so it goes from the very severe or the very from very severe where children need constant support for the most basic things, or you have the very mild ones where they're able to function. When we talk about autism, one person that comes to mind is Sheldon from Big Bang Theory, where you can see that they have difficulty. So Sheldon is typical ASD. He has problems with communicating. He doesn't understand, and that's the thing about people that have ASD. They're not able to understand social interaction. I have a young girl who I'm currently working with, and one of the things she'll tell you is she's 17. She tells you that my mom doesn't understand my language. For example, her mom says, "Rinse the cup." And when she says rinse the cup, mom means wash it, but mom says rinse the cup, so she would rinse the cup. They take things literally. So as parents, is how do we best communicate with these young people? So it's learning to help them, because they do not for them, things are literal. So if you say that, they don't understand jokes, they don't understand banter, because the way they think, the way their problems solving abilities is very, very different for each person. So one of the things what we say is that for people who have ASD, they have communication problems. They don't understand reciprocal social interaction. So they're talking to you, how they think you're thinking what they're thinking, which is quite very different. Another thing is that they have repetitive behaviors. So people like that have difficulties with change. So when you're growing up, you find out that the fact you have to change something, you change a routine, a child goes into a proper meltdown. So my bag is always been blue. So mom decides to buy me a red bag this year, and there is a significant problem because they can't do change. Sometimes you see that with your children, you can see some of these things, but as I said, they're all traits and everything falls on the spectrum. So I did put up some of the symptoms that we see. Children much younger, they're not able to play, they don't understand play, playing with a doll, they don't understand things like that. They avoid eye contact, they don't like people touching them, they don't like people hugging them. If they want to get something, they have difficulties in pointing and saying, this is what you want. And so that's the things we see in kids with ASD. So on to the next slide. So as I said, this is just me talking more about that. So they don't understand pretend play, which is something we see in children too. They don't understand mommy baby, they don't understand that, no. And sometimes one of the things they also do have problems with is they have unusual reactions to the way things smell, taste, or feel. So sometimes you have a child who's very rigid with their food. I know of a young child who would only eat dry cereal, nothing else in the day, just throughout the day, just dry cereal, and no milk, nothing, because they have problems with texture of food. So the next one to talk about is just the externalizing behavior. That's so we have things like ODD and conduct disorder. So, but actually ODD. It's actually it's one of these disorders that what we call there's a dilemma, there's a diagnostic dilemma, because some people do not recognize it. Actually, the NHS does not recognize ODD because they feel that sometimes it comes with parenting style. It's where there's a lack of boundary, but it's something that has been recognized. So I will just talk briefly about it. It's usually see that before the age of child. So what you see is that the child tends to be very, very defiant and very oppositional. So the word is they actually tend to annoy. They annoy teachers, they annoy siblings because they're actually argumentative. So we say, don't do that. And for what you say don't do is what they do. So do you say it's a very naughty child, or do you say, so and the reason why NHS doesn't recognize this is because there's no treatment. You cannot treat this medically. It's just parenting styles. So this is just a few, what do we see? They often get angry, they lose their temper, they argue with adults, they can be very resentful or spiteful. And as I said, they deliberately annoy some other people and would blame every other person for their mistakes or their misbehavior. So it's not my fault, it's your fault because you annoyed me. How do we help with young people here? One of the things is you learn to set boundaries, and it's usually by the parenting skill. So you do parenting skill training for these young people. conduct disorder. Sorry, I'm rushing. Any questions, please just put it in the chat box. Conduct disorder is the next thing, and conduct is actually a more severe form of ODD, which is the, and one of the things you do see is that there's actually aggression to other people, and they're trying to cause serious, there's actually the violation of rules and social norms. So these are the people that, they actually injure people, their children of do fire setting, they're the ones that you would go and they would, so sometimes extra people that are bully, lying, stealing, they damage other people's property. Those are west where you see, you have people with conduct disorder. So this is just me highlighting the major or the common mental health illnesses in children. So before I go into the next one, I wanted to know if there are any questions or if I should just go straight into it.
Thank you, Fikayo. Please, does anyone have any comments to put in the chat box? I'm putting mine at the moment. The first one I put was, so obviously from your experience with mental health in Africa and now here with Nigeria and now in the UK, I've said something about self-harm. I said self-harm, we generally know that from primary care that self-harm is, children don't do it, but intend to die. And there's a massive increase in the amount of children self-harming. So I was asking you, do you think it's just learned behavior from society, social media and Generation Z, new generation thing? What do you think it is? Because they're not doing it to die. It's not society. It's just a thing that they think they've seen on social media and they just want to do it. What do you feel about it? What's your experience?
Well, it's a very tricky one, because on some level we do see some children who are actually using that as a coping mechanism. So I would say on some level it's a negative coping mechanism. They're going through distress. You actually see their distress, and the way is they'll tell you is, I'm feeling quite distressed. One of the way to release this anger, this this self negativity, this anxiety, is just to cut yourself. Sometimes they do that. It's also learned behavior. The love thing is very common. So it's for us on the ward, because I've worked on the ward before. One of the things we tell parents when they come in is to say that children will learn behaviors. So you have kids who go into the ward without ever self-harming, and by the time they're coming out, they're full of scars, and it freaks your love parents out. So there is that part of that. They are learning that as a way of, but it's, as I said, it's a learned behavior as a negative coping mechanism to deal with distress.
So lots of the children I talked to, they said it makes them get a release. And I literally took like a blade the other day and I cut my wrist, because I don't understand it. Do you see what I mean? Like, I was just wondering, like, medically, there is no sort of, blood, that's it. Do you see what I mean? So is it it's almost like a false sensation of something that is real, because there is no release. So my question is it just the fact that people are doing it? Do you see what I mean? What do you find, what when you talk to these children, what do you understand from that literally slitting the wrist? And the second question I've asked is, ODD treatment is positive parenting. Yeah. So do you generally think that mental health in kids is the solution to largely parenting? Because I don't know how many of them I have given SSRIs to that has not worked. All the medications literally don't work. So I begin to ask myself that, what are we doing? What are we doing? Like, literally, Fikayo, what are we doing? Omon, you're a GP, you're there. CY and the rest of you. What are we doing?
I was going to say, doing? You actually sound like a GP, as and that's the thing, is
what
that,
doing?
It's actually very funny, because let me speak on the self-harm one. What they say is they feel this build-up of tension. It's like build-up of tension, build-up of anxiety, and the self-harm, and they feel some form of release. It's the same way I'll say that, why do people who say that they're feeling under stress, they smoke cigarettes? How does that work for them? Or people that go smoke or they take alcohol. It's for a lot of people, it's, as I said, it might be just a mind thing. Just sometimes you're feeling so distressed and you're like, what, punching a wall.
So it's an addiction. So what you're saying is it's almost like an addiction.
Yes, sometimes it becomes a form of, sometimes the competition. You would have young people, because actually if you walked on the ward, you hear young people saying that it's a competition between this person and that person. It's, so it's really, 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 and it's just how do you change that? You know,
it's now a societal problem now, because
yes,
what you're saying is
it
like
is a
smoking is like an
societal problem,
addiction.
yes.
It's a societal problem.
Yes.
So how do we change that? Because that's what we're about today. We need to change that, Fikayo. I mean, tell
It's
us,
about
what do you think?
parenting. You do really talk about parenting, school, being proactive. Like I remember when because I moved in about two and a half years ago, and my kids went to school, and they're like, you can't wear belts. I'm like, I'm sorry, why? If your trousers are falling down, because my son was wearing a belt, his trousers were a bit big, and he wore a belt. I'm like, oh, you can't wear belts. And I was like, why? Then I remembered, oh, self-harm. You know, you've had this. Obviously, it's a risk for a lot of young people. So for kids in primary school, they just take that out. It's a lot of, so sometimes a lot of parenting, I would say a lot of things, and it's people a lot. I have, if you talk to the older practitioners who are mental health practitioners, they'll tell you that society, there's a lot of societal things, there's a lot of changes in society. They never used to see children on medications. I have a secretary who was almost, you know, in her 70s, and she'll tell you, she's almost 70, and she'll tell you that when she started in the 80s, maybe they will have prescriptions, maybe one prescription per month, you know, then but in recent times you're doing about 5, 20, 10 prescriptions per day, sometimes if not more, you know. So a lot of people are trying to medicalize things, and it's trying to find that balance. Sometimes I have a lot of people who are general psychiatrists, like adult psychiatrists, and tell you that they will never do camps. They will never go into children and adolescent mental health, because as far as they're concerned, is you're doing social psychiatry, you're parenting the kids, and sometimes
you're parenting the kids. That's what I think as well. Even as a GP, I feel like I'm parenting the kids. I tell parents, just wake them, give them a routine. It will be better. Do you see what I mean? I feel like, because I can't give you medication, it's not going to work. You're too young, you know. So it's trying to, like, you know. I mean, that's what I find.
As you're a GP now, you know, we have other people that are not GP, so let's not have this GP argument. But
yes,
it's to say that how, you know, telling a parent that, oh, I don't want to medicate your child. Do you know how that is going to seem, and how, you know? So we're going to keep trying. We're going to keep, you know, that's why when we have things like this, seminars like this, where we can educate parents to say that we need you to be more resilient. We need you to teach these young children resilience. And as one person, I think the best explanation I've seen is that as parents now, and I think with society now, we've provided kids with so much, you know, everything, they have everything they need. And once they don't have that, when there's some anxiety, they're not able to deal with that. And it's a lot of things come out. So it's, how do we as parents tell our children that things would go wrong? You know,
absolutely. You know, life will throw you things.
Life will throw you things. Is how, and as parents, how do we, you know, cope? You know, equip our kids with this coping skills.
Absolutely. I have another question here, which is not the usual, you know, GP psychiatrist argument. As a parent, how do you help kids? This is Sandra, with social anxiety. Do you just let them grow out of it?
Well, it can, depending on how severe it is. Sometimes kids will grow out of this, but it's how do you best handle that? So if what's the severity? So social anxiety is a matter of, it varies. So it can be a matter of, well, I don't just like talking in front of people. I feel shy talking in front of people, and I'll probably just stay beside mom and keep quiet. To the point where this child is not able to enter the class. You know, so it depends on you know, so with every illness, there is a spectrum. So sometimes kids will grow out of it. It's by, okay, so exposure. So what we say exposure therapy is, as a parent, you can actually do that. Okay, let's just go out together. I'll be by your side. I'll hold your hand. I'll, you know, just talk to people, talk in front of me, then talk in front of other people, talk in front of me first, talk in front of your siblings, then go in front of, you know, family, and gradually exposing them to the outside world. But, you know, but sometimes it's so severe where you actually do need to see a specialist, where they might need to, so you speak to the GP would refer you to a specialist. So it depends on how severe things are. So with every illness, it's like saying, okay, I have a headache, or I have toe pain, to the point where, you know, let's use the word, I have a headache, and went to the point of a migraine where you have to see someone. So everything is a spectrum.
Okay. Someone, Linda, commented about she's had a sibling group which self-harming, would do self-harming, and is quite competitive. Like you said, sometimes it's quite who can self-harm more, and that's very, very societal. So I would say that, you know, tell me your friends and I'll tell you who you are, because it's all about putting your kids in the right setting as well. Dr. Iyabo commented, I think she's our pediatrician, and she said many children feel so entitled and just can't cope when they don't seem to get what they want, not necessarily their needs. They don't want to hear no, and it's okay to say no. Thank you very much, Iyabo. For me, I would always say that there's the difference between a want and a need.
Yeah.
And I don't give my children wants, I give them needs. Occasionally, the want is the treat. Does that make sense? So yeah, so I feel like, I'm not sure if it's working, but I just feel like that is how you build that resilience, because you keep doing good, because that day you might just get the chocolate. Does that make sense? Yeah, so that's one thing. Thanks, Iyabo, for that. Vaughn commented that any useful parenting links you can share for parents with children having these problems.
Okay.
Maybe when you're done, you can share some things with us.
Yes,
That's really
I would
good.
definitely do that. I would.
Yes.
Okay.
And Dr. Yabo then commented again, they should earn the wants, in my opinion. I support you, Yabo. That's my style.
Dr. Yabo, obviously, you're a very, very, very African parent. So yes.
Yes, exactly.
Is we as parents, I think we when you have children who, because obviously our background is quite different, where children understand what it is to see people hawking, and where you see, sometimes I tell people, take your child to Nigeria, child to where they see that life is, the fact that you have a 3 square meal is a luxury. It's not, it's not. I would say that I keep telling people that I was raised by my mom. Although my mom was a teacher, retired as a principal, I tell people that what my mom did for us growing up, I don't think I can do for my children. My mom sacrificed so much, but despite that, I know that there is a difference. She made us understand that there's a difference between what your wants and your needs. And as you said, so that's actually one word I use for my kids. It's as in this, it's a want, it's not a need, So
I tell my children, a holiday is a want, and you earn it.
And my daughter gives me this look of what do you mean? As in, what does that mean? She does, but I know in the future she'll definitely understand that. But there is a difference.
Move your hand from your mouth. Come and put on this light for me.
Okay then. I think let me just go so that, because we have just a few more minutes. I have a few more just to talk about causes of stress in young people, and just how do we best manage that. So yes, so stress, as I said, is an everyday part of life. It's and there are types, we'll sometimes call what we call good stress and bad stress, and it's how do we manage that. So one of the common examples of is, and I think Linda has mentioned some of that, is school. And obviously, as a lot of us are Africans here, so as Africans, we do keep the children feel under the need. There's that pressure to do well. I have people say, "Oh, your report card. Why do you have a 1? Why do you have a 2? Why not an EP? The other people, do they have 10 heads? At least we don't say that in my generation. I mean, my time, I was the first in my class, so I walked 10 miles to go to school. And I came back and I was still first. But we still do that. We're still very African, and we still tell our kids, because we expect, to whom much is given. I tell my children, to whom much is given, much is expected. But it's having to find that balance. Yes, we push them. We try, and we are meant to build on what their abilities, but at the same time, we need to find that balance for them. As I said, so school, we talk about exams. Obviously, we know that exam times that we actually, when you have, it's a bit funny, when we were young people who were here, I think what I realized when it came is that they don't have homework, they don't have anything, they don't have exams until they get to GCSE years, and all of a sudden they're having mocks the first time in year 7, and there's so much anxiety for them. Unlike, when if you're in Nigeria, that's every term we have exams, so you get used to it, so it's a bit different. And I think sometimes I'm like, I miss that Nigerian style, but it's just understanding that for young people, this can cause a lot of stress for them. We'll talk about peer pressure. Young children are beginning to, one of the things is, I have kids who are almost teenagers now. So one of the things is they're at that stage where they're trying to find themselves. They're that stage where they're trying to find where they belong. Sometimes that pressure of fitting into the society, fitting into their friends, fitting into, and especially where you're in a society where you're not necessarily, you're different, you're a minority. It sometimes does take a bit of, causes a lot of stress and anxiety for young kids. Yes, so one of the things is bullying. We know that there's a lot of bullying going on, there's one thing I say kids are horrible. Kids are actually very mean. I think in some level they're meaner than adults, because as adults we've come to we've learned to filter what we think. We know that some of the things we say are hurtful, but kids really don't think about that. They don't understand. They just say it as it is. So when you have a child who's been bullied, they sometimes are very severely bullied, and that causes a lot of children who I see, a lot of the triggers to depression, to anxiety, to not wanting to go to school, to phobias, is all, most of the time we see that a lot of bullying and that. Another common cause is world events. We're currently living in a pandemic. Linda has mentioned that earlier. Things are very different. Kids who are used to being outside for 10, 12 hours a day are constantly now being shot inside. So we have a lot of kids who are going to struggle with this, as in we have kids who have listening to the news alone is just anxiety provoking. As I tend not to listen to the news because it's just going to cause a lot of stress for me. So you can imagine young children, there are natural disasters, there's war, terrorist activities. And if you have a child who is very keen or listening to what's going on, because it's one of the things they need to do, understand what's going on, it's actually very distressing for these young children. A lot of times they worry about the safety of their children, their parents and friends. I've had young people who are constantly very afraid of the parents actually going out, and would cry and throw tantrums because, well, something happened. If someone got shot or got stabbed down the road, and it's really, really anxiety provoking for them. And another thing is family. Family changes, family difficulties, parents. So yes, for me, like relocating now, I had kids who relocated. It's a lot of stress for them. Things like even a new birth, people think it's just the negatives, just a new birth, sibling rivalry. The fact is, I was the only child. All of a sudden, there's this new baby that they're bringing in, and people think it's fun. You see a lot of videos about young people, how a child is reacting to hearing that they're going to be a sister to a brother. It's actually a lot of stress for this child. They don't know where's this child coming from, what's going on. Things are going to change. Those are things that we see. Moving to a new home, changing schools. Those are things that cause significant stress for young people. But a lot of times we just think about, when people talk about stress or in the family, they think about parental separation, parental divorce, parental death. Linda said something like a grandparent dying. We never really talk about that. The grandparent might be their closest friend, so those are things we need to talk about that we see that will cause stress on them. So those are the few points. There are much more things that will cause stress for a child. So it's just to speak to your child, as Lena said, create a bit of time for them, even if it's 5-10 minutes a day. What's going on? How was your day? Was there anything you found particularly difficult? And let's just walk through that. And how do we manage that? As I said earlier, it's make time for them. Just sometimes just being in the same room is just fine. Sometimes I have a son who will just come lie down beside me. We might not say anything to each other, or just go to their room. My daughter is almost my size, so sometimes I just go on her bed, lie down on her bed. She gives me this look of like, yeah, what are you doing here? But I just stay with her. It's just that I might not say anything, but after a while she comes and cuddles with me. It's just just making that time for them. It's also another thing is to encourage healthy sleep, which is very hard in this generation where you have 24 hours of TV, 24 hours of light, the internet, So those are things you need to do. Depending on the age of your child needs about 9 to 11 hours. We have kids doing less than that. So it's just trying to make sure they have a good sleep so they feel much better in the morning. Things like having a healthy diet, have a lot of fruits. There's a lot of junk food going on. I won't say don't give them junk, because obviously junk food is life. I'm a foodie. So it's just try and make sure their food is as healthy as possible. A lot of kids survive on cereal. A lot of kids survive on ready-made meals, microwave meals, because as parents we're really busy and we just find something to just find something to eat. But it's, if we can do that maybe once a week or twice a week, just have something together, as create it's another way of bonding, as another way of actually building skills for these kids, teaching them how to cook, even if it's the most basic thing, learning to make rice or fry pancakes, or just if it's making toast, but just doing that, because it also ensures that what they're eating. As I said, normalize stress. We said a lot of people have also mentioned that a lot of kids are not necessarily entitled, but they don't understand that everything is provided for them. Everything, they're the go-to. Everything is ready. You microwave meals. everything is provided for them. School is, things are literally much easier than it is. You put on lights. A lot of us grew up with not having constant electricity, having constant light, so they don't understand things that, so for if you talk about an African, like, oh, there is the fact that internet is not working is, for some kids, a lot of stress. For us, that you don't have internet, sorry. But it's just trying to say that, let's normalize the fact that they would go through stress in life. Everybody goes through stress. It's, and it's how do we best make them cope with this stress. Sometimes just take away things from them so you see how they react. Oh, you've annoyed me today, I'm going to just turn off the internet. And if they now miss, you are now over, okay, no problem, I will do that longer, so that you understand that they will know that there are things that are more, that the things that are worse than the basic things that you're missing now. Keep them active. It's this, a lot of people, especially people in the cities. I live in a very rural area where my daughter is out right now, and yeah, she's just somewhere in the town. Yesterday she was telling me she did 21,000 steps. She's just out with her friends it's a small town. They're just moving from friend's house to friend's house. I grew up in, anyone who knows Lagos, I grew up in Festac, so there's something I grew up doing. But if you have kids in the cities, they're literally just sat in front of their PlayStations, playing games and all that. So it's a hard, obviously. This is a small town. I think we're about 12,000 in my town, so it's easier to do that. But when you're in a city where there are knife wars, there are gangs, it's a bit difficult. So if we can, as parents, to take them out every day or every other day, just go for a walk, let's do exercise. And kids learn by examples. So you wake up in the morning, let's just go for a run or go for a walk, or just exercise for like 10-15 minutes, just keep them active. Things like relaxation techniques. So we've said things, so a child who's feeling quite anxious is just teaching them to breathe. When you're feeling quite anxious, how do you breathe? We have things like grounding techniques. If you have a child who's quite anxious, I tell people that if you have like a pendant, or just give them a chain with a pendant, and when they're feeling quite anxious, just touch it. When you feel something quite solid, it kind of grounds, what we call grounding techniques. And for you as a parent, how do you manage your anxiety? How do you manage your stress levels? Do you scream? Do you throw a tantrum? They follow by example. So if you can also manage your stress levels, they can copy you as well. So yeah. Any questions? Because I can.
Thank you
very much for listening.
Thank you so much, Fikaya. Thank you. It's really been really good that you've shed a lot of light into stress and anxiety in children. There was something you said about children nowadays not being used to taking any single stress at all. I mean, they have light, they have water, they have iPad, they have PS2. So it's kind of like, so and you go to schools, and I find out now that they've taken away the exams. In the past in England they used to have exams, and now there's no IA. I don't know whether you called it, is it CA, continuous assessment, or whatever. There's no test, there's no nothing. And all of a sudden it's time for 11 plus and SATs, and everyone is like having a meltdown. I mean, practice, my feeling with practice makes perfect. You can't teach a child how to handle stress without simulating some amount of stress. And if the environment and the society is trying not to simulate that, as parents, what do you think about simulating some stress? It may be what building some stress at home, like you said, take away that tab for 2 days. So yeah, we're not having the tab. What's going to happen? You're going to be alive. You're fine. You eat and you will sleep and you watch normal TV. So it's trying to let them know that. I feel for me, as a parent, obviously I can't change the system, but I feel like for me, I need to let you know that you're not going to have everything you want at every given time. We all go for interviews and we get rejected. We don't go and cry and shove our heads in the pillows. It's okay. Tomorrow you apply for the next one. After wiping your eyes after like 24 hours, you're fine. So it's trying to simulate those things as parents. I think that's the least you can do for your child, to be able to set them up for the real world. Otherwise, they go into the real world and everything becomes a shock. I can't do this. I can't get this. It's just kind of like, yes, it's really, really difficult. Pam said bullying is a trigger for mental health in children. Does anyone have anything to say about how they teach their child how to manage bullying? Because I tell my child that they are bullies and they will bully you, and you have to be confident and open your eyes at them and report them, and don't be scared of them. Like, you see what I mean? Even if they haven't been bullied, before they go to a place, I kind of prepare them for it. So does anyone have any tips on how they tell their child about bullying and how you prepare because it's all about preparing so that they don't get shocked when people say it. You see what I mean? So any comments? I don't know. Does anyone have anything to say about that? CY, do you have anything to say about bullying?
I think what I say is, for, as I said, prepare your children to say that a lot of people are not necessarily you will meet a lot of all sorts of people. Sometimes you're different if you're a minority, so you have that. So it's preparing them about it. And how else do you do it? For me, this is an example. So my daughter, this is first year, she came in year 6, and she had a young boy come and meet her to say, oh, I think he was trying to bully my daughter. I mean, if you see my daughter, you understand. My daughter is tall. She's my height. She's 13, but as at the age of 12, as at the age of 11, actually, she was my height. And I'm actually told I'm 5'9". So, and she just went, you want to fight with me? Come at me. And she's like, come at me. And the boy started crying. I went to go and meet, and she came to, like, I just said, you wanted to fight, come back to me. And so it's sometimes you need to stand up for yourself. So it's just teach them to stand for themselves, not go back and fight to them, but it's just a matter of, obviously, as parents, Nigeria, growing up, they say, if they beat you outside, I will go, and your parents will beat you. As in, they beat you outside, you're coming home to come and cry. Your parents will beat you back to go back outside and fight. It's not necessarily saying, not doing that, but just, that kind of, you need to stand up for yourself. I'm sure everybody has heard that, as most as if they beat you outside, just don't come back home crying. Fight first. They will now deal with you how later. So obviously, but you don't teach them to fight. But it's just saying you need to stand up for yourself and all those things. But as I said, then also try and report, especially if it's significant bullying. There needs to be documented evidence, to say that this is what's going on. And as parents, listen to your children. If you notice the child is not doing very well in school or doesn't want to go to school anymore, why don't you want to go to school? Is anything going on? You find out that because of that, sometimes kids, not everybody can do that. I wouldn't see my son doing the same thing what his sister did. My son is much calmer. So I call him, okay, what's going on? And if he's that, I will speak to the teacher. Then I'll say, oh, why don't you speak to your teacher? My son would rather speak to a teacher. So depending on the child, and you also know the temperament of each child.
Okay, thank you, guys. A couple of more comments. And one said social media certainly does make it worse, which is obviously classic, isn't it? So lots of social media policing for the children and trying to minimize tap times. Another comment was, there's a question on Facebook, we'll come to that. Dr. Mon says creating assessments at home and making it fun in non-competitive way. I prefer to do it in a competitive way, to be honest. Let's bring up the pressure, not all the time, just once in a while. Do you see? Like, I just kind of feel like, you have to be like real life. You can't just be living a false life. Then all of a sudden become an adult and have to pay direct debit bills. Let's call it spade a spade. We're all adults now. We see the pressure and we all have bills and we all have to go to work and we all have to parent. So you can't just be false and next minute you're now like, wake up and start doing all these things. So you kind of have to prepare yourself for it. That's my take. Dr. Yabo said, for bullying, report to the teacher, stand up for yourself, with a sarcastic response. I'll tell you mine in camera. Yes, so yeah, stand up for yourself and report to the teacher and give a response back to the bully. They might just melt down and start crying, and then you realize that, they're the ones who's actually weak. Now, something Vaughn actually said, I help them understand the psychology of bullying. Bullies enjoy to mistreat others because they're happy and they're unloved, and that is true. And you can reflect back their weakness. Children, it's a very good thing in reality, but I don't think children have that level of fun, that level of understanding to say, oh, I can see you're bullying me because you're weak. You'll never get like that response you want to say, yes, I'm truly weak. At that point, it's more like survival. It's like, oh, your head is big. Oh, you're saying that because you're really weak and you're unhappy, which is the truth. But children are so annoying that they will never accept that. It's going to be it's just going to be like a whole back and forth. So I feel like the children at that point, first of all, defend yourself. And then when you come and talk to mommy will tell you, that boy is bullying you because he's not a nice person and he's not a happy person. So feel sorry for him, but please defend yourself at the end of the day. That's what I do anyway. So yeah.
If I could just say, my daughter, the 8-year-old, she's a bit like yours, Fikayo, where my daughter's tall. I'm short. Pam will tell you I'm like 4'11", 5 foot, but I claim to be 5'2". So I'm about 5 foot, and my daughter's my size, but she's a bit on the chunky side. And she was having an instance of bullying, and that, the comment about the psychology of it. Definitely, I tried to have that conversation where I was just trying to highlight her these realities, and she didn't quite understand it. And it was something so simple. And I always say to her, you know, when we were young, we had that, I got it from my mama. I don't know if you know that song. And I said to her, do you know what? The next time someone says something really mean, act like it's not a problem and say to them, like, I got it from my mama. And she has managed to use that from when she was like 6 and she's 8 now. For 2 years, she's used that. And where children were bullying, it's really just stopped it, because guess what? She's like, I'm proud of it. I got it from my mama. You know, so this child that's coming in with this nasty thing, you're fat, she just turns it. And it's, you know, it's working quite well for her, you know, that she's actually just, it's not about putting the next child down. So she's not saying, oh yeah, I'm fat, you're skinny, you got a big head. It's not that nastiness. It's just about saying, okay, you said something, you know, it's not that bad. I got it from my mama, finished. So I think it's really, you know, I just want to share that because of the fact that, like, if we are saying to our children, stand up for yourself, it's not about being mean though. Like, don't be mean back, because then that also is a form of bullying, isn't it? You know.
Thank you very much, Linda. Yeah, I guess that's a good point, but survival first, to be honest. But you do have a point. Yes, you do have a point. And for me, I just always feel like I'm very, very protective. The other day, a parent told me that, oh, my child, I can't remember what they did, and something about the friends her child was playing with, and my child came with her big character and took away her friends. And I was like, sorry, she's been taught to defend herself anytime she's tried to put down. And that's like that's the first thing I say. It might sound a bit harsh, but I just feel like it's all about survival. And I kind of feel like with children, when they're really, really young, when it comes to their mental health, it's just more of self-preservation first. Then, you know, then they can then grow up to be that compassionate adult who will then listen to someone who's struggling. I know, I get your point. There's a question on Facebook. Would you say consistent body movements like tapping feet is a sign of ADHD? That's for you, Kayo.
Sorry. Okay. Consistent body movement. It can just be a form of, I know that when people generally shake their feet or shake their like the restless leg syndrome, like when we jog, people I wouldn't say it's a sign of ADHD if it's just one part of their body. Some people just use that to calm their anxiety. I know a few people who will do that, constantly shaking their feet, but doesn't necessarily have not be ADHD. What we say about people that have ADHD is that they're constantly screaming, so they don't sit still. So it's not about moving around. So I won't necessarily, so we can talk to Jessica later and just see someone who's like is constantly shaking. I have a few friends that when I'm sitting with them or talking to them, I constantly have to put my hand on their legs, like it's distracting, you know, but they're not even aware of it because for them it's just part of their ADHD. Is you're sitting down here and before you know it, the child is outside, the child is back inside, the child is on the bed, and the child is on the, it's, you know, you constantly, I would say you lose them in the supermarket. They're that child that you would always lose them, except you have, so, you know, sometimes when I see those kids with, what do you call them? I've forgotten the name. Those ones that you pull, like they look leash. Those are the kids you have to put on a leash, you know, so those, yeah, so not necessarily just a particular body movement.
Thank you so much. Thank you so much, Mikaya. I think our time is well spent, and it's really, really, it was really helpful having you to have a chat with us today. And like you said, the reason I wanted you to talk to us because we are in the same boat where we have patients coming to us and telling us my child needs some help, and we are bouncing patients from ourselves to yourselves, back to ourselves to yourselves, because there's almost nothing we can do half the time for children with mild to moderate level of mental health. A lot of it is parenting. Except a child is properly having schizophrenia or very severe, you know, depression with psychosis, medication usually is not started. And a lot of it is lots of parenting, lots of therapy. I was reading the book the other day on trying to let children deal with adverse childhood events, which has been shown to increase the mental health in children. So ACEs is called adverse childhood events, from grandmother dying to parents divorcing to somebody having an accident. And what the book says was the best way to deal with those big events is to carry the children along. So at every given time, you're communicating with your child to say, okay, hopefully not in this room, but for people who are going through divorces, like, you know, mommy and daddy are not going to be together anymore. doesn't mean we don't love you. You're a priority. You're so important to us. We're going to try our best to co-parent with you. We love you. You're still the center of our world. So people will go through stuff. Parents will get divorced. Grandmas will die, unfortunately. And, people will have accidents and there will be a pandemic. So the main thing is just, I feel, is just trying to carry the child along as much as possible, constant communication, constant therapy, and just making sure that you're in touch with the child and making sure you're supporting them as much as you can, creating some environments that are scenarios for them that are quite taking away the iPads, quite stressful environments, just to make sure that they are learning to cope. And like Linda said, authoritative parenting, of the 4 parentings you talked about, I like the authoritative parenting because there is evidence to show that children do well under authority. So as parents, your child cannot be your friend when they're 7 years old. There's no way. I'm my mother's best friend now, but I'm almost 40. And that's the reason, because she did her job when I was 7. Do you see what I mean? So you can't say my child and I were just hanging out. No, you're the parent. You parent the child half the time. Occasionally you come down to the level, you talk to them, but you're trying to do that to protect your adulthood. That's the way I see it. I'm trying to make sure that I have 3 best friends when I'm old. So I try to do the job now. So as a parent now, I feel like you should focus a lot more on building that child resilience. When they grow up, they will leave your house, they'll pay bills. The first shock they will get, their first salary will go into bills, electricity, water, council tax, and they're like, what is going on now? That is real life. Do you see what I mean? So it's trying to build that resilience in them from childhood so that when they grow, they are responsible adults, and you then can be their best friend, because then, you have people who you can reason with. So thank you so much, everyone, for attending.
Before you go, can I just say something? Sorry, I have to disagree with some of the things you said. Sorry.
There you go. Tell me.
Yeah, the reason why I'm disagreeing is because every child is different. Every parent is different. So some styles might work for some parents and it wouldn't work for some. To me, I want to be my 7-year-old child's best friend. I always tell them I'm your bestie. But when when it's mommy time, when it's time to do what I want, I also want to be that authoritative parent. So I think you can be a mix of both. That's where I'm trying to come into. You can be a mix of both. Because if you're not your child's friend, they won't tell you things. My son tells me things that happen that normally, if I was just being a strict mom, I wouldn't hear those things. And he's 8 years old. And I think, again, parenting is different at different stages. When your child is a toddler, it's different from when they're in primary school, and it's different from when they're teenagers. Some things will work for teenage children. Like I would say, okay, you can start building resilience gradually at that age when you're in primary school, but the kind of things you're using or the kind of tools or techniques that you use to build resilience in primary school will be different from when they're in secondary school. I grew up in Nigeria, and I grew up in a home where my parents were my friends, but also they were very strict when there was need to be. And I was able to tell my parents anything, and they were able to kind of build resilience and tell me. They were the kind of parents that used to tell us that you could be anything you want to be, but when you're wrong, they will tell you that you're wrong. They would deprive you of something that would make you think about what you've done. So that's the kind of thing I'm saying. So for every parent is different, and for every child is different. Some children.
But when you say you want to be your child's best friend, from my explanation of that, it means that
that's permissive.
You let them get away with everything, because you don't want to hurt your friend. Like you don't want to hurt me, or you don't want to hurt my feelings.
So that's
different.
Cut Ify short is what you've actually described is the same type of parenting style that she's about. So that's the balance. So you're not the authoritarian is where there's a problem, where because I said so is a valid excuse, but when you say because I said so without an explanation, that's why you say authoritarian. What you're saying is because I said so is actually a valid excuse, but I'm explaining to you why, and you're my friend. We're not best.
We're not best friend yet. No, not yet.
So that's or that's what we call authoritative, where it's a mixture of you actually mix permissive and authoritative.
Yes.
But it's authoritarian rather. So it's a mixture of both. It's so what you've just described is the same thing if he was describing that.
Yes. Yeah, so you can't say, I don't want to hurt you, so I'll let you jump out of the trampoline and break your head. Do you see what I mean? Like, no.
Parent is going to be like, it's because it happens a lot in psychiatry, and that's what we've seen a lot with these young people.
Of nowadays, isn't it?
Nowadays, yeah. It's a matter of, oh, mommy, I want £50. Okay, I don't have it. Okay, don't worry, I don't have it now. And your child throws a tantrum, and you're like, okay, no problem, I understand, because and you're making an excuse because that child, you couldn't give that child £50.
Yeah, but that's not what I meant when I said
that's my money.
That's not what I meant when I said being your friend.
Yes, I know, that's what I said. So that's what I was trying to explain. That. Yes, I understand that. Yeah.
Yeah. So okay, thank you for clarifying. Yes. Yeah, so like
I want to say something because I've been.
See why I speak.
It's just, sorry, I think Fikai already explained it, because when you said that if you're trying to make your child your friend, you let your friend get away with everything. No, in the first place, you're not supposed to let your friend get away with
everything. Fair enough.
If you're a true friend, you tell them when they are wrong.
Fair enough.
You tell them when they're right.
True.
I guess, understand me, in your part, as in the way Omon has the idea about being a child's friend, I'm of the school of thought that right now, you're under 10, we are not friends, I'm mom.
I'm mom for now.
But at the same time, I understand, because listening to what she said, it's also about creating that environment, because we've seen it where there are friends that are more comfortable talking to friends than to parents. I take it in the context of a young child. This is because when we're building resilience, we're preparing them for the world. A child being exposed to bullying or even something like sexual harassment and abuse, if they don't have that comfortable space, that comfortable niche to be able to come and express themselves, because they always see that as that authoritarian, they wouldn't be able to speak about it.
True. So there has to be some form of empathy.
Yes, there has to be a midway. That's why I said I think Fikaya more or less covered it. Yeah, there has to be a midway
ground. All right. Thank you, everyone. Any more comments before we wrap up? It's part 6 already. Tommy Saint Victoria, Foluke Sao, Akiremi, Yabo, Sandra. Thank you, everyone, for attending. It's also on Facebook streaming for those who came late. I want to use the opportunity to thank the leadership of BWIH for giving us this opportunity to have these conversations. Raising well and resilient parents, children is going to be running till July on the first Saturday of every month in the evening. Next week, I think we have a parenting coach. She's amazing. Her name is Ibiri Bolu, and we're looking forward to having her. I'm having her with someone else. I can't remember who, but we'll send out the invites in time. So please invite your friends, invite your family members. I think this is adding a lot of value to me personally. I'm learning lots of things like what we just talked about now. So I'm going to go upstairs now and sit down and read a book and do all those friendship things with my children right now. And I really appreciate everyone for attending. Thank you so much. And have a good and happy Easter. Bye-bye. Thank you, Fikayo. Thank you, Linda. Thank you, Siwai. Thank you, Omon. Thank you. Thank you. Thank you. Thank you. Thank you.